Hi, I'm Gary Bebow, CEO of WRHS System, and this is my September CEO Connection. I'm really pleased today to have Dr. Verona Brown be my guest, and as a form of introduction, I want to talk a little bit about some personal experience with sudden unexplained death in children. In June of 2013, we experienced a terrible event in our family where my grandson, Taylor Shelton, died in his sleep. Taylor was 15 months old, and just the previous to that event, he had actually spent some time with us at our home, and so it was obviously an event that we'll never forget, and one that ever since Taylor's death, we've been on a mission to try to prevent that from occurring elsewhere. And so today, I've asked Dr. Brown to come and speak a bit about SUDC. She's going to be speaking to the chaplains at their semi-annual dinner on September 26th, and she's also going to be making a presentation to Rotary on September 25th. And so, Dr. Brown, why don't you talk a little bit about SUDC and what we've learned over the last four years?
Well, SUDC, of course, is sudden unexplained death in childhood, which is by definition the death of a child after the age of 12 months. And up until a few years ago, or very recently, it was not even considered to be a health entity. And since that time, it has been incorporated into a diagnosis as sudden unexplained death in childhood, which can range from 12 months to older children. There is a foundation now for SUDC, and our children, Ella and Wes Shelton, have been very involved in that foundation, have gone to New York where that foundation is centered, and they've gone and have done some of the initial presentations and research for SUDC since Taylor's death, and been very involved in getting that actually proclaimed as a entity of a diagnosis. And so families who have gone through that loss actually have a diagnosis of the sudden unexplained death instead of just a unknown death, which many times it was labeled. And they have been very strong advocates for the SUDC Foundation, and in their efforts of that support, they actually gave money to White River Medical Center for SIDS and SUDS support, and they've been supportive of our Cribs for Kids program at White River Medical Center. In fact, they made the initial donation for the Cribs for Kids program to begin at White River Medical Center. And in the result of their efforts have allowed us to become one of the 2 gold members in the state of that program for SIDS, which is the condition of death in children that we see that is younger than 12 months, sudden infant death syndrome. In the past 15 years, there's been a lot of research in SIDS, and something that at White River Medical Center we thought we could help prevent in Arkansas. Arkansas is actually the number 2 state in the country in SIDS. So we lacked prevention in the state of Arkansas in SIDS, and the donation from the Taylor McKean Shelton Foundation enabled us to start this program. This program resulted in White River Medical Center giving every child that's born, every newborn from White River Medical Center is given a Halo sleep sack, and that gives that parent a sleep sack for that child to sleep in, instead of the child being in the crib with cumbersome and extraneous covers, which we do not recommend. And I'll talk a little bit more about that. Also, they will provide a crib for children if that family does not have a crib. One of the strongest recommendations for prevention of SIDS is that the child be in a crib by themselves, that they are not co-sleepers with anyone, including parents or other siblings. That is one of the highest risks of SIDS. As I talked about earlier, Arkansas being the actual number 2 in SIDS, there are some things we have found in the past 15 years that are preventable in SIDS. And those are the things that we're striving so much to help with in the state of Arkansas. What the research has told us is that the numbers of deaths by possibly suffocation or being in close contact with other individuals in a bed, being under heavy covers, temperatures being too warm in the bedroom, those types of risks can be significantly decreased by the child being by themselves in their crib, not having covers, toys in the crib with them, and significantly by the child being asleep on their back, not on their stomach, not on their side. Also, another risk factor, of course, is smoking in the home. It's recommended that the child be in the bedroom with the parents, but in their own bed, never to sleep in the bed with another individual. To not have heavy covers, as we talked about, and that's where our sleep halo sac comes into play, and to be in their own crib. So that's been a major impetus of this program. In addition to the 2 events that were mentioned, I will be a spokesperson for this program for White River Medical Center over the next year or so, and we will have some other events where I'll be speaking about SIDS in our program here and SUDS and what our family has done for prevention of these devastating loss of children in early childhood.
Well, thanks. I know you'll be welcome other people to come and see those, and we'll get that information out so when they're going to be, when they're occurring. Well, you've been in a change in office practice. You know, I know you've recently moved from your location on Lawrence Street over to, is it on Hospital Circle, or what's your address of your new office?
The address is actually 413 Virginia Drive. We're in the location where Dr. Montgomery's office was at one time, and the office has been remodeled to accommodate our practice. I have 2 nurse practitioners, Robin Kerr and Bobby Sutterfield is our newest addition, and we're thrilled to have both of those APNs working with our practice. And we've grown from 3 rooms, which was my old office location, and now we have 8 rooms for office visits, and hopefully we can move our patients in and out without long waits and can accommodate our practice better.
Well, I appreciate you coming and talking to me today, and good luck in your speeches and in your new office location.
It's been my pleasure.
Each month we select Employees of the Month at Stone County Medical Center and White River Medical Center. At Stone County Medical Center, Catherine Hattenauer from the Dietary Department was selected. She's been at SCMC for 6 years, and she's noted for going above and beyond in her work, helping any way she can. At White River Medical Center, Tabitha Russell, an RN at the Neurology Clinic, was selected. She's been with us for 9 years, and she was selected for the Employee of the Month representing Respect. So if you see Catherine or Tabitha, be sure to recognize them for their award. Both very well deserved. I'm really pleased to welcome some new providers and some return providers to the system during this last month. Jenny Callahan is an oncology nurse navigator, will be assuming responsibility in our radiology department at White River Medical Center. Amanda Johnson is a new hospitalist. She's family medicine, and so she'll be the first family medicine doctor to be as part of the hospitalist program, so we're really looking forward to having Dr. Johnson join us. Murray Kent is a physician that will be returning to Stone County Medical Center emergency room. We've all been really looking forward to her returning after 1 year away from Stone County Medical Center. So welcome back. Michelle Hagan, DNP, has joined the White River Medical Center Surgery Clinic. Joshua McIntosh, APRN, has joined the MPOC Orthopedic and Sports Medicine Clinic. Tyler Sandlin, an APRN, has joined the Children's Clinic along with Drs. Moody and White. And Cheyenne Wilson, a PA, has joined the MPOC Orthopedic and Sports Clinic. So a lot of brand new providers or returning providers, so I'll be sure to welcome them to the staff. The annual Employee Wellness event is scheduled for the last week of September at Waverly Medical Center. Be sure to check with your directors and attend the Employee Wellness event. As in the past, we'll be having opportunities, if you meet different metrics, that you'll have reductions off your health insurance costs, so be sure to come to the event. Beginning in July, we've had some major changes in our information technology systems. Meditech 6.15 was implemented on July 1st, and we've been also implementing an electronic medical record of Athena in several of the clinics. A lot of work has been going into those. I know a lot of stress and a lot of effort has been involved, and I wanted to be sure to recognize everyone that has been involved in making this major transition in information technology. Clearly, as in any major changes, there's challenges and some wins and some losses, and I want to encourage everyone to keep working hard at making these systems successful, recognizing that we've gone a long way so far, but we've got a long ways yet to go. So I really appreciate the hard work everybody has spent in these conversions, and encourage you to keep it up. At the end of May and beginning of June, we did our employee forum at Waverly Medical Center, and I've reviewed several of the comments that were made from participants. And basically I want to talk about three of those. Well, the first one was involved with the lack of adequate parking at Waverly Medical Center. As you know, there's a new entrance being created on the east side of the hospital, and once that's completed, we'll have an opportunity to improve or increase our parking in what is currently the exit onto Harrison Street. So it's a few months away, but we're sensitive to the lack of parking, and as soon as possible, we'll create some additional parking at that location. So that's the best answer I can give you right today in terms of parking. The second item that was talked a lot about in the surveys was the staffing levels, and several departments talked about the need for additional staffing. Well, as you may have heard, that we're currently undergoing a major benchmarking project right now, where we're looking at our staffing levels by department and comparing them to what benchmarks are more at the national level. And interestingly, as we're looking at those, we have some departments who are very lean right now, and we're very sensitive to the need to beef up the staffing in those locations when compared to the benchmark. On the other hand, there are some departments where, based upon the benchmark information, that we may have an overstaffing situation occurring. And so we certainly don't expect to make major changes in those departments overnight, but over time we're going to need to get the staffing in those departments more down to the national levels. And so the good news is we've got some opportunities that we can really reward those departments and increase their staffing. And there's some areas where we can also do better as well. Clearly, we have to be more efficient, more productive in the years that come, because you know, Medicare and Medicaid and government funding programs are certainly taking monies out of the healthcare system, and for this institution to remain viable in the future, we've got to be ever so more efficient and productive in the way we staff our hospitals. So believe me, I'm really sensitive to the need for staffing here. We just got to be sure it's at the proper level so that we can all remain viable. So I appreciate those comments as well. And finally, there were several comments about should we be moving forward with construction programs during this period of financial concerns. I want you to know that we are rethinking all of our construction programs right now. Some of the programs we've had underway, and obviously we got to complete those, but the ones that aren't underway, we're taking another look at those to see if there's not a lower cost, better alternative. So we, like you, like the comments that were made in the survey, we're really sensitive to to how we're spending our money, and we're going to take another good look at that before we proceed in further construction programs. So for all the comments that were made on the employee forum, I really appreciate your feedback, and rest assured I take them very, very seriously. Each month we put out a calendar of events for White River Health System, and on our Facebook and our website, WRHSSystem.com, you can see those. So periodically be sure to look at that calendar of events, and to the extent that you can participate, desire to participate, please do so. So this ends my CEO Connection for September. As in the past, if you have any ideas on how we can improve it, be sure to let us know. So have a great month.